At the first virtual Ifac World Congress, all plenaries and semi-plenaries are accompanied by a live element. This presentation is followed by a live panel discussion, where experts in the field recapitulate and debate on related ideas, questions, and open problems.
Welcome everybody to the COVID-19 panel discussion in the Ifac 2020 World Conference. The panel discussion is entitled Data-Driven Decision-Making in the COVID-19 Pandemic. I would like to thank the members of the panel for accepting my invitation. The members are Nuria Oliver, Commissioner for Artificial Intelligence and COVID-19. She's leading a group of more than 20 researchers devoted to help the Valencian government in Spain in the decision-making process. Sara del Valle from Los Alamos National Laboratory in the USA, she's actively collaborating with the Center of Disease Control and Prevention in the US. Julio Normay from the Federal University Santa Catarina in Brazil, he's modeling and designing MPC to mitigate the pandemic there. Giulia Giordano, University of Trento, Italy, she has proposed a very successful compartmental model called Siddharte that has been published in Nature Medicine. John Barter Jorgensen from the Technical University of Denmark, he leads a large COVID-19 control project involving around 45 researchers. He uses systems and control technology to contain COVID-19 in Denmark. Masaaki Nagata from the University of Kitakyushu, Japan. He's working with the Society of Instruments and Control Engineers in a working group for post-corona future society in Japan. Liu Zhang from the Beijing University of Technology, China, he's developing epidemic models with Lina Wang and Christophe Prieur to assess the efficacy of containment measures. Finally, Victor Preciado, he won the 2018 Best Paper Award by the IEEE Control System magazine for his work on the control of epidemics. He's now developing modeling, testing, and control technologies to combat COVID-19 in Pennsylvania University, USA. Thank you very much to everyone. Hello, welcome everybody to the panel discussion in the Corona session. We are going to start first with our first speaker, Nuria Oliver. Nuria, which are the main difficulties when trying to help the local administration in the decision-making process?
Hi, thank you. Thank you for the question. It's a pleasure to be here. Well, there are indeed complexities because we have to align the interests. We have to digest all the results from scientific work into actionable results that are also understandable by non-expert, people and audiences. We've been lucky because the team that I have been leading, and all of us, we are scientists, we have a director general who works for the president, of the Valencian region, and who is also a member of the team. And she's been coming every day to all the meetings, and she's the one that has been doing a lot of the translation work between the results of our analysis and what is meaningful and what is actionable from a public policy perspective, which of course we don't do, and we don't know. So I would say my biggest recommendation, if anyone was going to set up a team similar to this one, is to really have members of the team who are members of the policy-making teams and who are as committed to the team as the rest of the technical members and who understand what we're doing, even if it's at a superficial level, but that is deep enough for them to make sense of what we're doing and to be able to use it. And I think that has been really fundamental and very instrumental in the success of the work that we've been doing since March.
Okay, thank you, Nuria, for your answer. I would like now to address to Sarah, our second speaker. I would like to ask you, Sarah, in terms of non-pharmaceutical measures, how effective is closing schools or universities?
Thank you, Tio, once again for the invitation to be here. So we have been exploring different school reopening scenarios with our models. And what I can tell you is that one size doesn't fit all. If we were to reopen schools right now in the United States, we would get a very heterogeneous results because we have observed that you should look at the community transmission before you make decisions about reopening schools. If the community has low number of cases and low incidence of coronavirus, then you may reopen schools, but in communities where you still are observing high number of cases, then it may not be a good idea to reopen the schools. The schools offer the opportunity to congregate a lot of different kids that come from different parts of a community. And so then you are potentially exposing different people, and you're opening new transmission routes because then they're spending 8 hours a day in the school. And although it seems like kids may be less affected so far based on the transmission that we have seen around the globe, we still don't really know everything about coronavirus. So I think it would be better for us to be cautious. But right now, I think it's just very important to look at the community transmission before we actually decide to reopen schools and universities.
Okay, thank you very much, Sarah, for your answer. Now I would like to ask Julio, which is your opinion on the control theory addressing the challenges raised by the pandemic?
Well, thank you very much for the invitation, Theo. And it's an interesting question because, I think control theory can give some support to the study of the pandemic and to control the pandemic. But there are very challenging things in the study because we are working with a lot of uncertainty in the data. So the models we have to construct in order to apply control strategies are difficult to validate because of the data is not confiable. And then also when we apply the control strategies to the system, we really don't know exactly what is the control action we have decided to apply is really applied in practice. We are living this in Brazil in this year because we have several governments, local governments taking different decisions, and then if you decide to take some action in the system, then the population is not obeying that control action. So control theory can help a lot because you can obtain a closed loop actuations in the system that is better than doing open loop one, but there are a lot of challenging things in this system to obtain good results.
Okay, thank you very much. And related with Julio's answer, I would like to ask Julia, how do you face uncertainty in your models and predictions when you try to make decisions?
Thanks a lot for the invitation and for the question. Indeed, uncertainty heavily affects all epidemiological models. The available data about the epidemic evolution are affected by large noise and uncertainty. Hence, the model parameters estimated based on real data are uncertain too. So for sure, we cannot expect to exactly reproduce the epidemic course or to exactly predict the future epidemic evolution. We can provide an analysis that is based on a spectrum of possible future scenarios that depend on the adopted countermeasures and interventions, and also on unpredictable factors such as a change in the virus or seasonality, to provide predictions that take the uncertainty into account and help policymakers be aware of this uncertainty. We can provide confidence intervals for our predictions or associate possible scenarios with a likelihood computed based on probabilistic approaches, or we can perform a sensitivity analysis to quantify how our model is affected by parameter variations and uncertainties. Actually, in spite of uncertainties, models, methods, and approaches from our community have contributed valuable insight for public health decision makers. They have been precious to assess the effectiveness of the adopted intervention strategies and to predict the potential impact of various policy scenarios. Of course, what must be clear is that we're not looking into a crystal ball, but we are outlining what-if scenarios and future trends that are likely to occur under suitable assumptions.
Okay, thank you very much, Julia. And now maybe one of the questions of the pandemic. Dear John, do you think is it possible to control the pandemic just with mild interventions like face mask, tests, and isolation?
Well, yeah, this is a very good question. I think, yes, it may be possible when you have reduced the number of infected and infectious to a very small number, and then using early detection, these measures that you measure, isolation and contact tracing, then it may be possible. This is what the simulations show. Of course, if you're not quick at catching those that are infectious, then you may also fail. And as we just heard, these models are very, very uncertain. So the big question that we have in Denmark, where I work with the authorities, is do we have enough capacity to then trace the cases that we will see here after the summer holiday when people return from their vacation and maybe have been a bit more relaxed? But we are going to have a very extensive testing system to actually try to handle that case such that we can very, very quickly detect people that are infectious and then isolate them. But the uncertainty is the big question mark here, and we are also facing that. But I think it would be possible, and at least it's the strategy that many countries follow these days.
Okay, thank you very much, John. And I would like to ask Masa, in relation with the control theory and all this, there's also data science, but when you join everything, you come up with machine learning. Which is the role of machine learning?
Thank you very much. Hi, everyone. Machine learning is a modeling method from data, which is something like system identification in our field of control. And for a mechanical system like a DC motor, we have a very sophisticated modeling method using ordinary differential equations. And we design a controller for the system with a well-sophisticated method like H-infinity control, for example. On the other hand, for controlling the spread of coronavirus, we have no explicit model like a DC motor. And there are very large uncertainties, as Julia pointed out. So then recent machine learning techniques give a modeling method for that based on big data from GPS data from your mobile phones, for example. Okay, and by the way, I'd like to introduce an activity in Japan where we discuss such issues, and you can see this link to this web page, and I think you cannot click this. So please type this word. But in this page, you can find that in this group, we are organizing workshops discussing such issues to overcome this coronavirus pandemic. From this activity, I feel we need to collaborate with people from not only machine learning, but also economics and the social science to obtain a mathematical model of the human behavior or the society, which is very much different from a DC motor. Thank you very much. That's it.
Okay. Thank you very much for your invitation to collaborate. I would like now to address Liwo and ask him, how do you take into consideration all the challenges in terms of geographical distribution, nature of the spread and everything in your models?
Thank you very much. Yes, consider geographically distributed nature of the COVID-19 is very important, especially for some countries with the imbalanced healthcare systems. For example, at the beginning of the pandemic, there were 1,000 ICU units in Wuhan city for about 10 million people. The proportion is as high as some European cities in Spain or Italy, where the total population in Hubei province is nearly 60 million. It is regret that there are only 1,000 ICU units for the other 50 million people, except Wuhan city. The imported contingents might burden the shortage of the local medicine sources. After lockdown, we would have a transport effect for the business and the economic activities. The difficulties for the network model lie in the setup of the transmission among the regions. Currently, we have two parameters. One is static, the proportion of people who go from one region to another. There is a special temporal variables describe the periodic transport and distance among the regions. With Professor Christopher Prier at GIPSA Grenoble, the network model of the regions in France are simulated. The result has partially revealed the effectiveness of the social policy in France.
Okay, thank you very much for your answer, Iwo. Now I've got a difficult question for Victor. Okay, Victor, so which are the main challenges when you are trying to implement a control strategy in this COVID-19 pandemic? You have to unmute yourself, Victor.
Yes, there we are, yeah. So thank you for the question. I mean, there are several challenges in different directions. The first one is how can you build a reliable model when the data you access is unreliable? So that's one challenge everybody is facing, right? So the data you see out there, like the evolution of the number of infected or number of deaths, that we know is not reliable. Maybe number of deaths more than number of infected, but number of infected is definitely not a reliable signal. So that would be a challenge in one direction, which is how do we build a model from unreliable data? Another challenge is the limited control actions that we have available, right? So when we're dealing with a technological system, right, like a wind turbine or something of that sort, we typically have a very clear command signal and that we can use to control the system. This is not the case, right? So in here we are sending this, the politicians or whoever is upstairs is sending a signal of, the population trying to do certain actions, right? And these actions typically are discrete. So that's definitely a challenge. On top of that, you have humans in the loop, right? So the politicians can say to humans that you should use masks, but the humans are going to do whatever, right? And this is what's happening right now. We have an unreliable delivery of that control signal, right? So you can see that in many countries where essentially the use of masks is based on a honor code, right? Like in the US, you see that people are not going to use masks, or many people will not use masks just because they don't believe that's what they should do. And also in a different direction, just to wrap up my answer, in this control problem, we have a massive delays in the loop, right? So there is a large delay between the time in which somebody gets in contact with somebody infected and the time in which you see the consequence of that cause, right? So having delays between the cause and the consequence, that's really difficult in the control action. And I guess the control community, which is most of our audience, is very familiar with the implications in phase and all that stuff. So I think that those are some of the many challenges that we have to face when we're dealing with this control problem.
Okay, thank you very much, Victor.
Thank you.
Now, I would like to come back to Nuria, and because you mentioned in your talk about your COVID-19 impact survey, and I was wondering if it could be helpful in the hardest moment of an outbreak to monitor the COVID-19 incidence in the population.
Yeah, the survey has turned out to be an extremely valuable tool. So valuable that we decided to keep it ongoing. So we are right now on the 15th week of deploying the survey. We analyze it on a weekly basis. We have changed some of the questions to be more adapted to the new reality, to the new situation. And the answers are very valuable because they shed light on issues for which we don't have any data otherwise. So connecting with the answer before related to the fact that there is noisy, unreliable data, in some cases there is no data. For example, regarding a lot of the personal experience of the citizens during the pandemic. So this survey helps fill that gap of having no data. And we have really, really interesting answers. Some valuable ones right now are about the personal measurements that people take to protect themselves. So whether they are disinfecting hands, wearing masks, or avoiding crowds, or avoiding hugging and kissing, which is a very important social sort of like relationship way that we have in many countries in Europe. Social distancing, limiting contacts, increasing ventilation in rooms. And we find very high compliance. For example, in mask wearing in Spain is around 90% or 85+%. But we find very significant differences with age, where for all the personal measures, young people age 18 to 20 are much less cautious. They take fewer measures. We're also understanding how supportive people would be about a second confinement. And we find, surprisingly, a fair amount of support for a second possible confinement if there was going to be a second wave, which has surprised me because I did not think that was going to be the case. We've also have questions about the emotional impact, the labor impact, the economic impact, the contacts, how many contacts people have, close contacts during a week, which is very helpful for the contact tracing efforts. And then I just wanted to wrap up with one finding that I don't think it is emphasized enough. And I think it might jeopardize a lot of the efforts related to contact tracing, which is the fact that around 44% of the participants in the survey, and we have right now over 260,000 answers in several countries in the world, over 44%, this data is for Spain, report not being able to self-isolate if they had to isolate because of having been a close contact of someone infected with COVID-19. So that's a very high percentage. And the reasons are because they share a home, because they have to take care of someone, because they cannot afford it economically, or because they cannot afford it psychologically, including fear of stigmatization, which is actually increasing over time. So making sure that not only we're able to trace all the contacts, but also provide people with the right infrastructure and the right financial support and logistical support so they can isolate themselves, I think is an absolutely important point that I'm sure many countries or many regions are properly addressing. So I encourage everyone watching to answer the survey. It's in many languages, and it's a COVID-19 impact survey altogether.com or .org actually. And I think the answers are anonymous. So if anyone feels, it takes 3 minutes to answer it, and I would very much appreciate any answers. Thank you.
Okay, thank you very much, Nuria. Related with this last intervention, I have a question for Sarah. Sarah, as has been commented, the characteristics of your household, the characteristics of your type of work increase the risk for some people. This sort of risk assessment can be used in the modeling and decision making. What do you think about this?
So understanding risk is very important to accurately forecast the spread of coronavirus. And as I mentioned earlier, that our models obviously take a lot of data. And if we understand the differences in risk by age, gender, and also by location, by activities that people perform, I think we will be able to better understand how the disease can spread, and we can accurately forecast hospitalizations, deaths, and just the spread in general. This is very important for decision makers so that they can distribute the resources that are needed across the different locations that are affected by the disease.
Okay, thank you very much, Sarah. And now, Julio, the evolution of the spread of the virus is changing every week. What do you think is the best approach for addressing this issue?
Well, this is an interesting question also. Now we detect that the problem that the dynamics of the virus is varying with time, and that we decide to start to study an approach that considering simultaneously 2 problems. One is the estimation of the parameters in an adaptive way, in such a optimization problem to the past in order to obtain the model parameters. And with these parameters, you use the predictions in the model predictive control. So the problem you have is a 2-side optimization problem, one to the past and one to the future, in order to adapt the model, for example, every week, every 5 days or 10 days, and try to make a control decision that is in closed loop, adaptive to the reality of the spread of the virus. And the other thing we are trying to study is to use a small region instead of using model of the whole country, try to use small regions and try to apply this strategy there, that we think we are going to obtain better results that's considering all the countries that have very, very different region and different situation in each one of the parts.
Okay, thank you very much, Julio. Now, a last question for Julia. I would like to ask you, which is the potential of testing, isolation, and contact tracing when the number of cases go beyond a given threshold?
Actually, yeah, without suitable pharmaceutical interventions, effective treatments or vaccines, all we can do is prevent the virus from spreading. And to the same, it is fundamental to test, to promptly isolate infected people and trace their contacts so as to identify and break the contagion chain as soon as possible. Of course, this is a huge effort once the number of cases go beyond a certain threshold, but it is really indispensable. With our Sedality model, we have shown that widespread testing and contact tracing indeed help end the epidemic faster, also combined with social distancing and the use of personal protective equipment. And a massive campaign of testing and contact tracing is the only way to relieve lockdown and social distancing restrictions safely. Reopening too early without adequate testing and contact tracing would lead to a resurgence of the epidemic. So combining lockdown and population-wide testing and contact tracing is crucial. But for massive testing, we need a lot of resources. And in the presence of limited testing capacity, it is fundamental to optimally choose who and when to test. And it is important to find clever testing strategies to maximize efficiency of testing and still effectively monitor the epidemic situation.
Okay, thank you very much. With this, we have to finish our panel session. Thank you very much for everyone for participating. Also, thanks to Frank Algover and Julian Beveridge for helping me to organize this. And remember that we have to fight all together. And there is a Corona website organized by Ifac and IEEE that you can find easily on the web. Thank you very much. That's all.
The interested participants now have the choice of attending one out of 2 semi-plenary presentations delivered by Zhou Jin from the City University of Hong Kong, China, and Dana Coolidge from Monash University, Australia, respectively. Unfortunately, you will now have to choose between 2 options. But please note that all plenary and semi-plenary talks will be available for viewing on the Ifac YouTube channel. While not immediately possible, you will have the chance to later watch the presentation that you missed.